We're going to be talking about, of course, our employee benefits effective January 1st, 2021. My name is Bill Hammond. I'm honored to be your insurance broker. My contact information is on the screen there. I'm available to you now during open enrollment, as well as throughout the year if you're having issues, if there's claims issues or finding a doctor issues or accessing care issues or whatever it is. Myself or Tamara are available all year long. And over this next week of open enrollment, if any of you have questions about the plans, what's available, what's the best choice for you or your family, I'm available to you to help kind of walk you through the options and kind of steer you towards what would potentially work best for you guys. So please feel free to reach out if I can help. Our agenda, we're going to talk about open enrollment, dates, benefits, changes. The big change is going to be how we're enrolling. As we've gotten further along with technology and then hit with COVID, we're going to lean on it heavy. And so this is going to be a fully paperless enrollment experience. You will be doing it all online, which we'll walk through here shortly. So open enrollment. So it's going till Friday, December 18th. This is the time in which you can enroll or disenroll in benefits. You can waive them. You can add a dependent. You can remove a dependent. You can move from, one plan to the next. It's your free look period. This is when you get to do whatever it is you want to do with your plan. Any changes that you make will be effective January 1st. So if you're on, say, a Kaiser plan now but want to go to Sharp, that change will happen on January 1st. Again, please try to get this done no later than Friday, December 18th. For those of you that have questions that are preventing you from making a decision, let's set up a time where we can talk sooner rather than later so that we can get done by Friday the 18th. And we'll be doing all these applications online at the Ease enrollment portal, which again, we'll talk about. If you decline this coverage, you will have to wait until next year to enroll in plans unless you have a qualifying event. So let's say that you decide you do not want the coverage that's being offered to you because you're not 26 yet and you're still on your parents' plan, or you're on your spouse's plan, or fill in the blank, you've got another health insurance plan. If you were to lose that plan, your spouse maybe loses their job and their coverage, or you turn 26 and you lose your coverage. That's called a qualifying event and allows you to enroll in the health plan anytime during the year. The stipulation that if you don't do it now, you have to wait till next year really just applies to people that are turning the offer down and do not have any other coverage. So if you're turning this down and you have other coverage, don't worry. If you were to lose it, you can join our plan. We've got 8 medical plans available, nice spread between Kaiser, Sharp, and Blue Shield. We're going to go over them a little bit in some detail on the next couple of screens. And then all these benefits are available to you in the enrollment portal. So you'll be able to kind of look deeper into all these plans in the portal. So here's our silver plans from Kaiser. So there's 3 silver plans and they're all very, very similar. I've made some highlights and made some of the font red in places where the plans are different. So the Kaiser Silver 70 1650 refers to the deductible of $1,650. The other deductibles are $2,100 and $2,250. So a deductible is generally what the insurance company is going to ask you to pay before they start paying any of their portion. Now, there's a lot of exceptions. So if you're looking at this very first column, Kaiser Silver option number 1, you'll see that once we get down into physician services, you're going to see copays, $55 for a regular doctor visit, $80 for a specialist, DED waived. Lab and x-ray, $30 and $75, DED waived. All the way at the bottom, urgent care, DED waived. Whenever you see DED waived, that means you do not have to meet your $1,650 deductible before getting this copay. So if you're joining this plan for the first time on January 1st and on January 2nd, you need to see a doctor and go have an x-ray. You are not going to be asked to pay any of that deductible. You will only be asked to pay the copay amount. Now, if you look below that at imaging where it says CAT scan, PET scans, MRIs, that says 350 after DED. So for some of the more complex imaging benefits, you're going to pay your deductible first. Now, these plans are not much different than one another. So if you're looking at the silver plans, I want you to really think about what's important to you. What's important to you is the prescription drug benefit, note that on the Kaiser Silver option number 2, it's got the highest brand name drug deductible at $500, whereas the option number 3 with the $2,250 deductible has the lowest deductible at $300 for brand name drugs. Also, that 2250 has the best hospital benefit and outpatient surgery benefit. So the plans are very similar. They'll be priced very similar, but keep in mind your unique needs for these plans. If all that matters to you is your maximum risk, what is my worst case scenario in a calendar year, you'll notice that the out-of-pocket maximum is $8,200 for every one of these plans. So your worst case scenario, if you're somebody that says all I care about is my worst case scenario, then I would just pick the cheapest silver plan available, and that would be the best value for you. Last thing on this page, you'll notice that deductibles and out-of-pocket maximums have 2 different numbers. The first number is if you're enrolled all by yourself, you have a deductible of $1,650 and out-of-pocket max of $8,200. If you have more than one person, those numbers are double. Now, what's important to note about that is even if it's a family deductible of $3,300 or a family out-of-pocket maximum at $16,400, number one, those numbers include the deductible above. And number 2, no one person in the family unit will be asked to pay any more than their individual maximum. So if it's me and my 2 daughters on this silver option 1 plan here, and I get into a car accident and have $1 million in claims, I will have met my deductible in full once I've paid $1,650. After that, I'm going to pay 40% of the cost for all my hospital services. Kaiser pays 60% until my deductible plus 40% equals $8,200. At which point Kaiser pays 100% of the cost for my services for the rest of the calendar year. My daughters would have the other half of the deductible and the other half of the out-of-pocket should they have expenses. So no one person in a family would be asked to pay more than their individual out-of-pocket, and no family on the whole would be asked to pay more than their family out-of-pocket maximum. Any questions on those Kaiser plans we just talked about? Okay. We have a couple of Sharp plans. We have 1 silver, 1 gold. You'll see the silver plan's got a deductible and out-of-pocket maximum. Looks a lot like those Kaiser silver plans we just looked at. Silver plans are going to be really great for people that want to spend the least that they can out of their paycheck, don't have a ton of needs for medical services, but would like to have copays for doctor visits, lab work, x-ray, prescription drugs, urgent care. These silver plans are a really great value when it comes to what you get for your dollar. Now, the gold level plans, these are really good for people that use their health plan a lot. If you're using your plan a lot, if you have a surgery coming up, if you're going to have a baby, if you've got regular MRIs you need to get, whatever it may be, sometimes there is wisdom in paying a little bit more out of your paycheck to get a plan that really lowers your cost out of pocket when you use your plan. So, for instance, if the gold plan costs me another $50 a paycheck over the silver, but when I need to get an MRI, you'll notice I only pay 20% of that cost, and I don't have to pay the deductible of $350. Whereas on the silver plan, I'm going to pay the whole thing up to my deductible and then 30%. So just right there, that's probably a difference of $600 or $700 or $800 in the 2 plans. So that's an example on how spending more on premium, which is pre-tax, so you're not taxed on that money, can lower your out-of-pocket expenses that are after tax dollars. So those are the 2 Sharp plans we have there. Any questions on either of these Sharp health plans? Okay. We also have a couple of additional plans. We've got this Blue Shield plan on the left here. This is a silver PPO plan from Blue Shield. This is a much different plan than anything else we have offered. There is a much larger network when you get into PPO plans. They have a lot more providers, a lot more doctors, a lot more choice of who you see. So if you are someone that values choice more than anything else, or maybe you have a big family where the pediatrician is at UCSD, but your doctor's at Scripps and your wife's is at Sharp, you might need a PPO plan so that you have all of that in your network. So that's the PPO plan. Going to be one of the more pricey options that you'll see, but what you're paying for is a much larger network, the freedom of choice, the ability to self-direct who you get your care from. And then the last plan here in purple on the far right is a Kaiser Gold level plan. So for those of you that like Kaiser and have some expectation of having expenses in the coming year, this Gold plan is a tremendous value, especially if you look down here at the hospital services benefit. The Kaiser Gold plan is a copay of $600 per day, no more than 5 days. Meaning you'll pay a copay of $600 day 1, 2, 3, 4, 5, and then day 6 and beyond of a continuous hospital stay, you will not pay anything. So if you're thinking of having a baby or you got something going on, you're going to be in the hospital, this Kaiser Gold plan would probably be the best plan that we're offering because your copay, your cost to be in a hospital is maxed out at $600 a day for the room and board, which is great. Any questions on those plans there or any of the medical plans that we discussed? Okay, so let's talk about dental and vision. There's no changes here. There's no changes to plans or rates, so it's pretty easy. We've got our HMO plans with Delta Dental. HMO dental plans are really great for someone that just wants a couple of free cleanings and doesn't want to pay a lot to get it. These dental HMO plans are going to be super affordable on a per paycheck basis, and they have copays across the board for every service. So you'll see in the preventative basic major, there's some big ranges in copays. That is only because these benefit summaries are 11, 12 pages long because literally every single service, there's hundreds and hundreds of services, have an individual copay. So from that perspective, it's hard to show you the individual copays. But what you need to know about an HMO dental plan is it's going to be lower cost. It's going to be less choice of dentists that you can see. So it won't be as big of a network as a PPO dental plan would be. And you're going to pay a copay for everything. So there's no annual maximum. You never run out of benefits. Everything's a copay. So pretty manageable when it comes to that. Also, with orthodontia, there's a copay for these services with the HMO plan. So if you're interested in orthodontia, that's going to be the route you want to go. The Delta plans, we've got two plans, the PPO Gold and Platinum. PPO plans are a lot different. PPO plans will cost you a lot more out of your pocket, but they will give you a lot more choice of dental provider when you want to use your plan. So if you've got a particular dentist that's very important to you, a PPO dental plan would probably be the way you want to go because that dentist might not take an HMO plan. So if you want to see a particular dentist, the PPO is the way to go. PPO plans, unlike the HMO plans, though, have a maximum benefit. The Gold plan has a maximum annual calendar year maximum benefit of $1,500, and the Platinum has a $2,000 maximum. Now, maximums mean the opposite of what they meant with medical. With medical, we said once you hit that out-of-pocket maximum, you pay nothing else, and the insurance company, Kaiser, Sharp, Blue Shield, they would pay the rest. Well, with dental plans, it's the opposite. Once Delta Dental has spent $1,500 on your claims in a calendar year, they pay nothing else and you pay everything else. So this is the big drawback to a dental PPO plan. while you get a lot of really great choice and there's some really fantastic providers on the list, you also can run out of benefits in a calendar year. The way benefits are listed are a little different with a PPO. With an HMO, we looked at nothing but copays across the board. With PPO plans, they break everything down into three categories: preventative, basic, and major. Of course, preventative is covered at 100%. That's your cleanings, that's the fluoride, that's the x-rays. Basic is going to be things like, cavities, even endodontics, which is root canals, and periodontics, which is the deep cleaning. That's covered at 80%, meaning Delta pays 80% of the cost, you pay 20% of the cost. And then major things like oral surgery or crowns or bridges, that's going to be a 50-50 split. The last thing I'll say about our PPO plans is the platinum level plan uses the Premier Network. The Delta Dental Premier Network is one of the largest PPO dental networks in the country. So if you really have a special provider that doesn't take a lot of insurances, there is a good chance he or she takes the platinum plan with the Premier Network. So that is what you need to know about those two plans. Any questions about dental? Okay, so we're going to look real quick at our enrollment portal for benefits. This is where you're going to do everything: enrolling and declining, understanding the plans, finding a doctor, downloading the smartphone app. There's a lot of really cool resources in here. I'm going to do a quick walkthrough with you guys if I can. So what we're going to do is get out of here. You're going to be looking for this email. Right after this call is over, I'm going to be sending an email to you guys. It looks just like this. It says, "Welcome to Ease. You've been added to the Ease, our benefit portal. Helps you navigate, blah, 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 December 18th, all that." At the bottom, you'll see a little sign up button. You're going to go ahead and click that button. It'll take you straight to the portal, the enrollment portal. Once you get here, when you get here for the first time, you're going to be asked to put in a password and then accept the terms and agreements of the system. So go ahead and do that. Once you've logged in and chose a password, you get back here, you're going to go ahead and just hit your password and log in. You're going to go to the open enrollment bar here. It says start enrollment. Boom, right there. Gives you an idea of what you can expect. You can do this on your phone, a tablet, or a desktop computer. You'll hit start here on the benefits enrollment. Here's the overview. I'm recording this presentation and I'm going to embed it right here. So if you missed any part of it, you wanted to go back and see the benefits, or you're just a glutton for punishment, you can watch it again here. If not, you just hit continue. It's going to ask for your profile, all your information. You're going to go ahead and put all that stuff in here. Lots of asterisks, lots of mandatory fields. Continue. It'll ask you about your dependents. If you have any dependents, please enter them here. Putting them into the portal does not mean you're enrolling any of your dependents. Putting them into the portal does allow you to very quickly toggle between enrolling everybody, enrolling some people, just yourself, and you get an idea of instantly on what things cost. If you have Medicare, go ahead and put it here. Otherwise, go ahead and skip it. So once you get to this page, this is the important one. Now, it starts with specify your coverage, and it'll have your name here. These are grayed out. The check mark and the X are grayed out right now because you have not been in this system and you have not made a choice. As soon as you check the box to enroll, it's now going to give you all your prices below it. Now, here it indicated in my profile I had a spouse, but I didn't put her in here. So I'm just going to say she's on her other group plan. And if I know the name of it, then I can put the numbers. If I don't know, you can put, some fake information here just to get through. And here now I can see the plans I want. So if I want this Silver 70 plan, $93.58 per pay period for me and my daughter. And up here on the top right, you're going to see your costs tally up live. So if I say, no, I don't want to enroll my daughter, you see the numbers change instantly. So this is why I'd like for you to insert or install your dependents if you have any, so that you can quickly see these numbers change. So we're going to choose that plan there. There's a little link, summary of benefits. So if you want to look at more details on the plan, you can find that information there. Here's a little easier to understand benefit summary. So if you want to see it in a different way, both of them say the same information, just show it in different ways. So here's all the plans. You'll notice you can just kind of scroll all the way through. If you choose this SHARP plan here, you'll notice that it's going to mandate that you choose a primary care provider. You can hit the auto assign button. And what auto assign means is that you're telling SHARP that they can choose your primary care doctor for you. Remember, with an HMO plan, with a SHARP HMO plan, you have to choose a primary doctor and always go to that provider first. If you auto assign it, you can change it anytime you want. So this is not the only time you have to choose this, and you're not stuck with Dr. Death if that's who they prescribe you. You can change that anytime you want. Or if you know exactly who you want to go with, you can use this link here to look up the providers in the performance network, put their ID and their name here, and you can hit continue. For the ease of doing this, I'll hit auto assign. We get into dental. I want it for me, but not for my daughter. Okay, why not? Spouses group plan. Okay, what's the reason? All that. Okay, fine. Again, if you have the information, go ahead and put it in there. If you don't, you can do the kind of that dummy stuff there too. I'm choosing the PPO Gold plan here. This is 11/21 a pay period. Now notice I'm tallying up my information or my costs on the right here on a per paycheck basis. For those of you choosing a dental HMO plan, you need to choose a primary care dentist. I've included not only the benefit summary of this plan, but a link to the actual Delta Care USA, the Delta Dental site for you to find a dentist right there. But also I've recorded a video tutorial that is just a YouTube presentation that in 2 minutes will show you how to work through the Delta system and find your provider so that you can list their name at the bottom of this, at the bottom down here. Now, if you choose a PPO plan, notice it doesn't have, you do not have to choose a primary care provider. And again, a link to the Delta network is right there. Vision, we didn't talk much about vision yet, but we've got two plans, the gold and the platinum. Now, these plans are 89 cents different per paycheck. I want you guys to do one of two things with vision. Either turn the whole thing down, you don't need it, or buy the platinum plan. And the reason why is these two plans are identical in the network of providers that they serve. They are identical with the $10 annual eye exam benefit. They are identical with the $25 copay for new lenses once every year benefit. The difference is the platinum plan gives you the $180 allowance for frames every year. The gold plan says you can only have that benefit every 2 years. All right, so for what amounts to about $24 a year in pre-tax premium, you get $180 in tax-free benefits. So I would encourage you guys to choose the platinum level plan if you want vision. And if you don't, of course, you would just waive it. No big deal. I'm going to choose the platinum plan. Again, I can click here to find a vision provider. It takes you right to the VSP site. I promise it does. Okay. You can look at the benefit summary. And all of these summaries you can download, you can print, you can do whatever you need to do. But this gives you an idea of what those benefits are. All right, so now we've enrolled. We've got everybody signed up. We're going to look at our summary, employee child, employee only, employee child. That's how I want to be enrolled. If that's not correct, you'll just go back along the left side here and choose the benefit you want and how you want to enroll. If it's okay, you'll hit continue. You'll sign forms. Now, this is a lot like a DocuSign. There's two signatures, one typed and one you will use your actual mouse to do. So you'll just kind of, looks like you did it with your feet, but it's okay. Next. And now it just takes you through the whole application and inserts your signature everywhere that it's needed. Once you get through all of them, you'll get shot right back to the top. You're welcome to go through and look at this application. If you'd like, you can print it. But if you're all done, you'll look up here at the top right and you'll hit finish signing. And then you can give us any feedback if you'd like. And then the last thing on the top right is you hit finish, and it's going to take you back to this home screen where it shows all the plans that you enrolled in. If you do this and you realize later on, a couple days later, but still during open enrollment, you want to make a change, you just come in here to manage enrollment and make a change to the plan you want. Maybe you want the Kaiser plan. Okay. So that, guys, that is the enrollment portal. Does anybody have any questions about the enrollment portal?
So we're just keeping what we had the previous year. Is there anything just to push as far as keeping benefits as was last year?
So if you want to know if you know what you had, then you'll go through and you'll just select it. That is not going to be pre-selected in this year. Now, every year following this, yes, it's going to be indicated that you took the Kaiser Silver 1650 plan. This was the price, and then it will pre-select that same plan for the new year. So every year after this one, it's going to have your historical choices, and it will show you what that is, and assume you want to keep it the same and pre-select it. But for this initial enrollment period, if you know what you have, it should be on your ID card. It should tell you. Then go ahead and make sure you choose that one. And if you are not aware at all, or if you don't know, you can get a hold of me, and I can tell you, or Judith has that information as well, and she can let you know. But you can just shoot me an email real quick and say, hey, I'm not quite sure, I don't remember which plan I'm on, or if I want to keep things the same, what am I choosing? I can look that up for you very, very quickly, and would be more than happy to do that.
Okay.
Any other questions about anything we talked about, or that we didn't talk about that you want to talk about?
Hey, Bill.
Yep.
So I may have missed it, but if we're not going to participate, we still have to go in and fill out the information for decline, correct?
That is correct. Thank you, Judith. Yes, everybody that gets an email needs to take action. If you want to be enrolled and stay enrolled, you need to log in and make those elections. If you wish to not enroll and decline the benefits, no problem at all. Honestly, God, no problem, whatever's best. But yes, you also need to go in. You need to just select decline. It's going to ask you why, and you'll say I'm on coverage elsewhere, and here's the name and the number. So yeah, we're asking everybody to do something. Okay, so I'll assume there's not more questions. I will, as we wrap this up in a few seconds, I will stay on the line until everybody hangs up, in case there's anybody that has a question that comes up at after we're ending the meeting, or if there's something that you're just don't want to, talk about in front of the whole group. I will stay on. My information is up on the screen, and I welcome hearing from any of you if you need me. Last request is that we get everything done by Friday the 18th so we can get into the insurance company, and all the changes will be in there for the 1st. And be on the lookout for an email that will arrive to you at about 3 p.m. sharp today. Thank you guys for.
Okay, I have a quick question actually for Judith and everyone. We do have everyone's email address, correct, to get this done?
That's correct. We do.
Okay.
Now,
Bill, I appreciate the time.
Yeah, for sure. Now, guys, this is new technology, and everybody's using different devices and at different levels. So if you get a snag or something like that, just let me know, or you can let Judith know, and she'll get me involved, and I can unsnag you. The technology is super, super good, super efficient, but it's technology, and sometimes it glitches up on you. So if that happens to you, don't get too frustrated, and don't wait too long to reach out for help. We can usually help you on the back end, or help kind of walk you through what you might not be seeing, or if there's any issues. So thank you guys very much for your time on a Friday afternoon. I appreciate it. I am here for you if you need me. I will stay on the line, but otherwise, have a great rest of your day and a great weekend.
Thanks, Bill.
Thanks,
You too.
Bill.
Thank you.
Thank you.
Thank you.